regarding Lyme disease and co-infections that has impacted so many people's lives, especially over the last 10, 15 years. A number of people I know that wanted to be here tonight couldn't be because of prior engagements, and so they were glad to hear that this will be recorded. This you'll be able to search on YouTube. You can go to our Facebook page for our church or even our church website and get to it. So if you want to access this again, because there'll be a lot of information, he's going to try to give us not quite warp speed, but a boatload of information we will get tonight. Some of you may have been here in May, but we also had him here just to talk about functional medicine and the proper way really to heal the body. And so we are delighted to have him back. I consider him a good friend as well as my doctor, and looking forward. I thank you for coming tonight. He will give a little bit of time for question and answer at the end. So you might want to save up something toward the end as well, but I turn it over to Dr. Ross.
Thank you, Pastor Keith. Thank you. And we'll also be having it on the Turnpaw website. And if you sign up or had a chance, not yet, there is a sign-up sheet out there. If you put in your email, we'll make sure we'll kind of blast out the email with the link as well. So there'll be some multiple avenues that you can get access to the recording. And then also there is a 20%, I think it's either 20 or 25, I can't remember, today's been a blur, out there as well. If we do end up running out of that, that's for new patients only. If you're an established patient, sorry, that doesn't apply. But if we end up running out of them, just contact my office and just let them know, hey, I ran, Dr. Ross had the talk, and we didn't get a coupon. We'll make sure that everyone gets an opportunity to have that. So anyways, thank you again, Pastor Keith, and for Karen, I think she's still outside, for allowing me to speak. I really do enjoy this. I will try to keep this relatively brief, that meaning under an hour. I'll try that. This is a very broad topic, meaning it's not just going to be in regards to Lyme disease. We're going to hit upon a couple other things that tend to get missed quite a bit. But as you can see, we're going to be talking about what is Lyme disease, what are co-infections, which get missed quite a bit. What does it do to our body when we have one of these bacterial infections, because that's what they are. Some common myths that common questions and myths that get asked by me very frequently. Why is it so hard to test, right? That's something that is very rampant in regards to false negatives and misdiagnosis. And then what are some signs to be aware of? And we're going to go into cursory treatment because it's very, very complex, and there's not this is a Lyme protocol, just go and do this, right? You're going to find out that it's not as simple as, I just got 100 milligrams of doxycycline from my doctor. He says me to take it twice a day for 2 weeks and I'm done. It's not as simple as that, and you're going to find out shortly here why. So just a little bit of history in regards to Lyme disease. So in the 1970s, there was a community outbreak of arthritis and facial palsy. Also, you're kind of aware that I like to move. I was up here last time. It worked. I'd rather be down there, so it's a little bit odd for me being up on a pedestal, so to speak. But I'm going to move around and talk with my hands a lot, so just kind of ignore that piece. But anyway, so it was in children and adults in Lyme, Connecticut, hence why it has the name Lyme, because that's where it was originally created, and so therefore it gets Lyme. After years of requests from local residents, a certain resident, Polly Murray, finally basically got an investigator from the CDC and basically got an expert in rheumatology and infectious disease. Naturally, he thought it was an autoimmune disease, not an infection, and the bias kind of still exists, right? That's something that we're going to talk about. Is this an infection, or is this an autoimmune? Is this an infection that triggers an autoimmune response, right? So that's a very highly debated topic, and I can tell you for the thousands of patients that we have seen, especially with chronic Lyme. Now, that's not the correct vernacular in traditional medicine. It is called post-infection Lyme treatment. I might have messed that up exactly, but I have it in my slides here. I'll make sure I correct myself. But if you're in standard medical terminology, if you call it chronic Lyme disease, you get a wrist slap. Okay, so just so that's on record, I'm on recording. Chronic Lyme disease is not the correct vernacular. But for this conversation and ease of conversation, we're going to continue to call it chronic Lyme. So in the early 1980s, the NIH tick researcher, this is where we get the name, Burgdorferi, right? It's Borrelia burgdorferi is Lyme disease, okay? That's the actual name of the bacteria. So Willie Burgdorferi discovered a spirochete. That's the type of bacteria. That's that kind of corkscrew-like bacteria. Again, you're going to see a picture in just a couple minutes, where it's able to drill down into tissue, right? This is why it can enter into the nervous system. It can enter into cardiac tissue. It can enter into digestive tract. As we all know, it loves the joints, so it can enter and spiral and drill into joint tissue as well. So that's kind of why we get that spirochete. But this was in the ticks collected in Shelter Island, New York, which is, funny enough, about 20 miles away from Lyme, Connecticut, that has a perfect migratory pattern of birds. That's how it kind of got carried over there. Eventually, the spirochete was named after Burgdorferi. 1982, 3 sample serologies were developed as a diagnostic test. However, many of these patients who fit the clinical picture of Lyme did not have positive testing, and that's where the big debate starts, right? And again, we will discuss about that topic, that debate in detail here. Later in the 1980s, it was discovered that ticks may contain other pathogens that are transmitted along with the Lyme disease, the Lyme spirochete. So again, another kind of layer gets unpeeled, right? It's not just Lyme. It's not just Borrelia burgdorferi. There are other co-infections. First, Babesia was found, then Ehrlichia, then Anaplasma, then Bartonella, and then other species of Borrelia were found. It became clear that while many were seronegative due to poor testing, it also became clear that many might have one or more of these pathogens. So again, we're just going to talk about the testing here and how that's a little bit, it's not as cut and dry, which makes it hard for us as clinicians. But this is a little bit of more facts in regards to this. Each year, more than 30,000 cases of Lyme disease are reported by the CDC in PA. And so if that's being reported by the CDC has very, very strict criteria. So I can almost guarantee you that's at least 2x, right? Because if it's not a full-blown true diagnosis, the CDC is not counting it as one of their numbers here. However, the CDC estimates that the total number of people diagnosed with Lyme disease could exceed over 300,000 annually. Okay, Lyme disease in the United States has approximately doubled since 1991, averaging at a 3.7 per case of 100,000, and it has since 2004, so that 2014, so that's a long time ago. I'll have to refer to, is this it? Oh, Apple TV. There it is. For some reason, it must have got kicked off here. Good? Perfect. And I'll just make sure we're good. Awesome. All right. So sorry about that. So again, in 2014, so that's a little bit outdated, right? 7.9 per 100,000. We know that number's up. I can tell you that's up easily above 10 per 100,000 easily. So we can see that it's becoming more prevalent, right? The numbers are growing, right? This is just a report from the CDC from 2000 to 2017. We can see in that nice New England corner that kind of creeps down into our neck of the woods how prevalent it is. Also out in that Michigan area, but it's growing, right? So it's not just in these really highly dense populated in regards to wooded areas, but we're also seeing it in Florida. You can see a high amount there. You can see it starting to creep in California. So this is something that we have to be, worried about, not just in considered endemic areas. And again, 2017. I know I'm not the most updated with the data here in regards to the slide here, but that's considerably more. So Lyme disease. What is Lyme disease? Lyme disease is a spirochete. Okay, so it's got that corkscrew-like tail that can burrow into tissue. Right. That's what makes it so difficult to detect and makes it so harmful, right? So Borrelia burgdorferi, senso-lato complex, that can be transported by different carriers. I'll get into that, but the most common is the being ticks, right? The Lugstocks scapularis, right? The deer tick, which this affects. We know affects joints, it affects immune system, affects the cardiovascular system, can affect the central nervous system, which I kind of already mentioned how it kind of can burrow in. So it typically is slower in progression. So compared to some of the other co-infections, this is a slower in progression bacteria, right? There's no night sweats involved with it. So like I believe it's Babesia. Again, I have it in my notes here that accompanies night sweats, so you can kind of pair up some of the symptoms and potentially rule out or rule in regards to some of these symptoms. So again, no night sweats. It's a 4-week cycle. We know it's very migratory in regards to its joint pain, so it tends to jump around, hit different joints. There will be some cases where, it just stays in the knee, but really it's in my knee one day, next it's in the left knee, now it's in my shoulder. It has that migratory pattern. And then nuchal rigidity, so big fancy word for neck pain, right? Base of the skull. Then I put some other potential, again, co-infections here: borreliosis, anaplasmosis, babesia, Poisson virus. Then we have other kind of Borrelia species here. There's tons of them. You can see Borrelia miyone, Afzeli, Guarini, Microti, so the Babesia microti. So there's even within some of these, the big three, right, which are Borrelia, Babesia, Bartonella, there are even more species under that. So it can get really complicated really quickly. Next is, so I kind of talked about the big three, right? First one being Borrelia, that's known as Lyme disease. Then we have babesiosis, okay? So this is considered a co-infection. I get this question all the time. Dr. Ross, if I have a co-infection, does that mean I also have Lyme disease? No. Does not mean because you have one, you absolutely have the other. They can be separate, right? I always tell my patients this. Give this an example. Tick hops on a deer. The deer has a Babesia infection. That's the only infection that it has. It then jumps on you. Now you transmit that Babesia infection. It just acts very similar. I say it's a cousin to Lyme disease. It looks like it talks like it walks like it, but technically they're not the same person. So Babesia is caused by, so it's basically caused by protozoans. It's thought to be caused by parasitic infection. That again is most commonly caused by ticks. Less commonly, this is seen to be passed through blood transfusion, but it's thought that it can be passed through blood. And we know that all of these infections are transplacental, meaning they can be given to your beautiful unborn baby if you have an infection. And we will talk about that. I dedicated some slides to pregnancy and these bacterial infections. So symptoms, more severe than Lyme, okay, so they come on quicker, right? There's a quicker response. It includes fever, fatigue, chills. This one, you're going to have sweats. Again, rapid onset of symptoms. Again, we talked about night sweats. We talked about fatigue. Some increased hunger. And then this has waves of cycles of 5 to 7 days. So a lot of the times, patients will report, it just comes and goes. So I get a little bit better, it comes back. I get a little better, it comes back. And it kind of has this wave-like cyclical presentation. And that's very common. Anemia is very common with this. Iron deficiency is more common with this. And more global headaches, okay? So Borrelia, nuchal rigidity, right? Neck pain, more just global headaches for Babesia, okay? And Babesia, night sweats. Borrelia, typically not night sweats. Borrelia, remember, is Lyme disease. Okay, Bartonellosis, all right? So now here's our third one, okay? And there is some that I haven't covered, right? Ehrlichia, we saw on there. We saw anaplasmosis. Again, these are not that these are not important. They tend to be a little bit less frequent, but just know that those are bacterial infections that act similar to Lyme disease. So, borreliosis is caused by an infection from protobacteria. Transmission is typically vector-borne, right? Flea, lice, ticks. We'll talk about other ways of vectors or transmission. It's typically a gram-negative homotrophic short rod bacteria. That's fun. Everyone loves that information. Bartonella species are associated with fevers. Now, typically morning fevers, okay? Origin tends to be unknown why we get these fevers, well, other than the Bartonella. Typical and atypical cat scratch disease. So Bartonellosis is kind of known as cat scratch fever, right? So just be mindful of that if you've got a lovely kitten as an animal, and they're outdoor. Be very careful. And then we have, again, so basically here I put in some medical terms, but I think it can affect the liver. Again, it can affect the heart. We can see ocular issues, right? We can see more ringing in the ears, right? More tinnitus or neurotinnitus. And then, again, CNS, excitability, psychosis, anxiety, seizure-like activity. So those are the real telltale signs of Bartonellosis, right? More excitable, more anxiety-ridden, even bouts of psychosis, seizure activity. You're leaning more towards Bartonellosis or Bartonella. So some Lyme physiology. So again, as we mentioned, this is a vector, okay? This is how Lyme needs to spread through a vector. Basically, vector is the immunology term in regards to it needs something to transmit it, right? Now, it takes typically 38 to 48 hours for the bacteria to enter the bloodstream, okay? After about anywhere from 3 to 21 days, the bacteria can now spread via the lymphatic system, and that's when it starts going to other areas, right? So again, it can cause swelling through the blood to organs and other skin and tissue. Some animals have shown to have transmission even in 24 up to 24 or 72 hours. So it might not take those couple weeks time to transmit. Now, we're going to talk about briefly here that 36 to 48 hour in the bloodstream, and then that 3 to 32 day transmission time. I'll save it. I don't want to go to it. I don't want to ruin it. Okay, but I will talk about the transmission time because that's a very highly debated topic there. But this is a lovely little picture of the spirochete. Again, the bottom picture doesn't do it as good, but you can see how it has that kind of curvilinear shape. And there is, again, that tail, almost kind of like a worm. Think like it can worm into tissue, just like how a worm kind of digs its way into the ground, right? That's a fun thought to think. But that's its capability. So here's a comment about rapid transmission. So a lot of the times I'll get, well, the tick wasn't on very long, it wasn't engorged, I was able to take it off, am I okay, right? And a lot of conventional doctors will say, oh, you're fine, that's nothing to be worried about. There was no bullseye rash. We didn't have any erythema. You're fine. There's nothing to be worried about. I wish that was the case. So you can see here, Burgdorferi, 5 to 10% of ticks that are carrying Lyme disease have a systemic infection and have microbes that are in their saliva that can transmit as soon as they bite you, okay? So you can get a Lyme infection from just a single bite. Clinical evidence for rapid transmission of Lyme disease following a tick bite. So again, Lyme transmission, so that's all good, but again, the highlighted point, therefore never exclude the possibility of infection after a short attachment duration or if that tick is not engorged, right? You should be getting some type of testing if you have a tick. And I'm going to, again, we'll talk about some of that. So Lyme presentation, and we kind of talked about the symptoms, but here it is in more of like a stage-like fashion. Stage 1, we're going to have the potential rash. You might not always have a rash, okay? The CDC reports that over 50% of their diagnosed Lyme disease never report a rash or a tick bite, like that bullseye rash, right? So again, that's another one. Well, I didn't have a rash. Doesn't mean you did not get an infection, okay? And again, if we're saying the CDC is reporting it, you can know that that number is probably greater than what's being reported. So again, stage 1, rash, neck pain, stiffness, fatigue, aches, headaches, slight PM temperature, okay? Now we're in stage 2, which is the disease is now disseminated. So we're now having more of that migratory joint pain, more of that arthritic pain, more of that rheumatoid pain, which was originally confused as, again, that was first thought to be juvenile rheumatoid arthritis, which they found out that it was Lyme disease. So you know when you're starting to get joint pain, that bacteria is now starting to spread. It's now starting to get in the tissue. And then we have the late stage, stage 3. Now we're having more neurological involvement, okay? We're having more potential cardiac but muscle involvement, muscle fasciculation. This is where we get the odd burning, kind of shooting pain sensations, a lot of potential even seizure activity, a lot of brain fog, difficulty with thought process. We're starting to get that into the CNS involvement. Now we're unfortunately, we're in for a long haul for recovery. So this just talks about, again, some of the diversity. We talked about Borrelia, we talked about Babesia, we talked about Bartonella, but obviously I just wanted to mention, again, that there's more than this. So in 2018, over 10,000 plus patient samples were taken, almost nearly from every state. And you can kind of just see the percentage here. 37.7 were positive for Babesia, 32.1 for Lyme Borrelia, for 27.7, which is tick-borne relapsing fever Borrelia, 19% Bartonella. You guys can read here, but you can see Anaplasma, Rickettsia, Ehrlichia, and then co-infections. 40% tested positive for 2 or more pathogens, right? 15% positive for 3 or more. But again, you can see it's just, the point is, it's not just Borrelia. It's not just Lyme disease, okay? So some common myths, right? I've kind of touched upon a couple of them already. If I don't have the rash, the bullseye rash, do I have Lyme, right? It doesn't mean that you do not have Lyme disease, right? The tick just bit me. I can take it off. I'm completely fine, right? It can transmit. It still can transmit that infection. Okay. Just because I didn't have this perfect bullseye rash, right? In your viewing top left, these are other presentations of rashes that can be correlated to Lyme and other co-infections. So it's just not that perfect bullseye rash that can represent an infection. And then vectors. Vectors is not just that tick only. So I hate to scare you, but it can be more than a tick that transmits that bacteria. Okay, so we have ticks, we have fleas, we've got black flies, infected water, snails, mosquitoes, your pets that you love. I get concerned about that. Blood transfusion, sexual transmission. Okay, that's a one that people don't tend to realize, the pets and the sexual transmission. Data on it is still a little bit hypothetical, but it's starting to become more confident in the research that it can be transmitted sexually. Continued. So I kind of touched upon this, right? Transplacental infection of human fetus has been recognized for syphilis, leprosy, other spirochetal organisms. So that was the other thing. With that original case, that first case, they did a spinal sample, and I believe they found leprosy, or I can't remember exactly the exact situation, but because these are spirochetes, just like Lyme disease and these other co-infections, there's actual medication. There's a medication that is called Dapsone, which is originally created for leprosy. It works really effective in regards to treating persistent Lyme disease. So these things do have some crossover, and it's kind of scary to think about that, syphilis and leprosy, and how they have kind of similarities in regards to Bartonella, these Lyme and co-infections. I just want to make sure I'm not missing any comments in my head that I wanted to share with that. I think we're good there. So again, kind of to talk about other mechanisms of infection, right? Now, I want to state here, CDC reports spirochete bacteria cannot be passed through breast milk, okay? CDC states that. I just wanted to put a little pin in your head. Here is a research article. Breast milk is a route of tick-borne encephalitis virus transmission from mother to infant, right? Tick-borne encephalitis virus is transmitted mainly by tick bites, but humans can acquire infection through consuming unpasteurized milk from infected animals. If you can get it through an infected animal from milk, if a woman is infected, could it be possible that she transmitted through her milk? Right? So I'm not stating anything for the record. Just want you to think. That's all. Next is persisters and biofilms. So this is where it gets tricky. This is probably one of the most difficult things to deal with when it comes to Lyme and co-infections, because if we're not addressing biofilms, these bugs can live, and they can continue to propagate, essentially. So what are biofilms? Biofilms and persisters can somewhat go together. Basically, persisters mean that the bacteria is persistent. It's not getting eradicated, right? And it's creating a chronic Lyme infection, right? I do that because, again, we're not supposed to do chronic Lyme. It's post-treatment. So small fractions of dormant bacteria, cells that survive antibiotic treatment, right? These are persisters, right? After. We didn't have this the first time, I promise. I promise. It will get. Maybe it's telling me I need to go faster. Maybe that's what. I'm not seeing it come up. Let me see. Did you go into general? It just and it just popped up again. Here we go. Sorry about that. There we go. It should be coming back up in just a second, everyone. There we go. Okay, so again, that can survive antibiotic treatment and can regrow, leading to post-treatment relapse. There we go. It's post-treatment relapse is technically the term. So making sure we're addressing biofilms, right? Usually what we use, we have, you can use like stevia, surprisingly. NAC, N-acetylcysteine, is a really good biofilm disruptor. We use something called biocidin. That's my favorite. It works wonderfully. And again, so this is similar to TB and leprosy. Microorganisms, so this is the biofilm piece. Microorganisms adhere to the surface of some object in most environment and begin to kind of reproduce. The microorganisms form an attachment to the surface of this object kind of by secreting a slimy glue-like substance. That's that biofilm. So I tell my patients this. You ever seen kind of that green film on top of like a body of water? That's a biofilm. We have biofilms existing in our body naturally. This bug is really good at protecting itself, so it burrows itself in that biofilm, acts as like a shield, and then we go and try and kill it. You can't kill it, right? So you need to take a biofilm disruptor, you dissolve the shield, remove the shield, and now you can get access to killing that bug. Okay. In regards to persisters, right? Sometimes that bug can actually burrow deep into tissue, and it can kind of lay dormant and basically survive in that tissue and being non-detected by the immune system and by testing, dependent on the phase that it's in. So again, you can see these are very tricky organisms that have adapted and learned how to adapt. There's something called quorum sensing, which I'll get into at the end, but they can also, it's also thought or hypothesized that they can quorum sense, which I will talk about that a little bit later on when you're probably all asleep. But really important, if there's one piece that, because a lot of people come in, they know about Lyme disease, they're educated on it. There's one thing that people miss that's really important is these biofilms, right? So that's probably like one of the keys of this talk, okay? And I love that picture. What a great slide, what a great stain, whatever. Micrologist. Yeah, I just think that's so cool. You can see how slimy it is, right? And it kind of attaches to everything. Herxon reaction. So when we're treating this, Dr. Ross, I feel worse. What did you do to me, right? We can have everyone knows that it's die-off, right? So basically what's happening here is this bug, its last little gift, as it gets killed, it releases its internal contents, right? And it circulates in the bloodstream, right? So we now have more toxin kind of circulating in the blood. If we're not detoxing effectively, or if we're not giving you some support, you can feel more sick, okay? Flu-like symptoms, okay? That's what I tell my patients. Mild flu-like symptoms or cold symptoms, right? Fever, more malaise, more joint pain, right? Dr. Turnpaul would always say, if you're feeling worse when we start, that's a good sign, okay? So, but there's things that we can do, right? We can use to reduce this. We can use glutathione. We can use NAC, IV Myers cocktails, alpha-lipoic acid, diindolylmethane, that's your DIM, clay, and activated charcoal to kind of bind those toxins, right? These are all really good ways to prevent that die-off or that Herxheim reaction. Okay, so a little bit about testing. I know we mentioned earlier that that testing is very, for lack of a better word, skeptical, right? There are some really good testing out there. We use MDL, Medical Diagnostic Laboratory. They're very good. The leader in this right now that we're using very frequently is Vibrant. Vibrant is another really good test. And if you're in the Lyme community or know really anything about it, you've heard about IGeneX, it's just incredibly expensive unless you're in Medicare, so we typically don't use IGeneX. But those are your best tests, okay? So laboratory testing. Standard testing lacks sensitivity for early and late stage infection in Lyme disease, okay? So this is what becomes an issue. So first off, what I'll say is, if you have a tick bite and you have any signs of facial palsy, any signs of rash, go get treatment right away. Don't wait for testing. Go get treatment. Standard, even in conventional medicine, standard protocol is you get treatment right away. And again, it's with traditionally 2 weeks of 100 milligrams twice a day of doxycycline. That's your standard process. But this graph here, you basically have, is what they're saying is you have pretty much a 2 to 6 week window to catch that. And outside that 2 to 6 week window, it gets pretty hard to catch an acute infection, okay? So you can see the kind of blue checkered line under the kind of like at the bottom of the second mid-stage parabola or curve here, right? That's a small percentage of patients produce IgM antibodies through the entire stage of the cycle. So at that point, it's very likely you're producing IgM antibodies, which show an indication of an acute infection, okay? Then that next checkered line, which kind of sees like a little bit of purple, now you're in the, some people aren't producing IgMs or IgGs, which is kind of like, it's your memory response, but it's also indicative of a chronic Lyme infection. So sometimes these, again, it's just kind of bringing relevance that it can be difficult to catch. And antibodies typically, so patient comes in and says, I think I have a Lyme infection. I removed the tick, no rash, it wasn't engorged, but I think I got infected. To get IgM antibody production, it can take 2 to 3 weeks. So you might go and get that test right away, and it shows completely perfect. Oh, I'm normal, good, I'm in the clear. Well, you have not stimulated the immune system. The immune system did not have enough time to stimulate those IgM antibodies, okay? So you think you're good, and then 2 or 3 weeks later, you start noticing some symptoms. Not a good sign. Again, just some more information on testing. The mean sensitivity for all tests for all samples was 59.5% and 53.7% when compared to the two-tier methodology. I'm going to talk about what this means in just a second, but it just kind of just shows again that sensitivity for two-tier testing, and so that's the 53.7. 59 is the single tier testing with a reflexive response to a Western blot, which it's going to sound like gibberish right now, but I will kind of connect the dots. The two-tier test generated over 500 more times false negative results than the two-stage HIV testing, so just comparing it to HIV, just kind of standard testing, that it has a lot more false negatives, meaning it misses the infection. So what does that mean by two-tier testing and single-tier testing? So again, I can't tell you how many times patient comes and goes, oh, my doctor ran Lyme testing. Oh, okay, let me see it. And 9 times out of 10, it is the EIA testing, right? They typically one of the two. So either the enzyme immunoassay or the immunofluorescence assay. So basically, it's kind of like it's a very inaccurate test, right? But they basically just run this single test, and if it comes back negative, no other testing is done. Nothing else on your viewing right is done. So that's your single test. Now your two-tier test is where the doctor will run your EIA or EIF, and then they will also run a Western blot, okay? So you can kind of follow it here, right? If the negative results, it's considered an alternative diagnosis, right? Basically nothing's done. If it's a positive or equivocal, signs or symptoms greater than 30 days, this kind of just, but basically they'll just run a Western blot, okay? A Western blot is helpful, it is beneficial, but you should be having that run immediately, right? So again, this kind of just talks about the standardized type of testing. We run a Western blot. We run a C6 peptide. We run a slew of bands that are associated with Lyme and co-infections. But you can see, I just wanted to mention, according to the CDC, IgM of 2 of the 3 IgM bands that are tested in conventional medicine, you need 2 of them to be IgM positive. IgM is like an acute infection. So a little bit of serology, you get the infection, the immune system responds to that infection. Immediately you start producing IgM antibodies. This is to kill that infection right away. That takes about probably right around 2 to 3 weeks to create those IgM antibodies. Then after, I would say, about a month, maybe a little bit more, you'll start producing IgG antibodies. These are memory cells, so that if you get the infection again, you can kill it quicker and don't get as sick. But this is the issue. If those memory cells keep going up, right, something is driving that memory response up. So a lot of the times, it's an underlying or an unresolved infection that's continuing to drive those IgG bands up. So with IgG antibodies, there can get some complexity, but just think of it as that. So according to the CDC, you need to have 5 of their 10 that they test. We test, I think, we test a lot more than 10, let's put it that way. So if you do not meet either one of these criteria, you do not have Lyme disease according to the CDC. Okay? So you could have 4 IgG bands. You could be 1 short. Nope, you don't have Lyme disease. But I have all the symptoms. Nope, you don't have Lyme disease. You could have 1 of the bands for IgM. Don't have Lyme disease. Okay? So we just talk about the sensitivity and specificity. The 2-tier testing is very specific for Lyme disease. So it's very good to tell you if you have Lyme disease, but it's doesn't have the best sensitivity. So you can see your ELISA or your IFA, so that's the one on the very far left. That's about a 70-75% sensitivity. Then you add in the Western blot, which are these bands that I talk about, the 2 of 3 and the 5 of 10. That's your Western blot, about a 70-75 as well. Overall sensitivity about 50%. And then a C6 peptide, which is kind of like, think of it as the bacteria is replicating, and as it's growing, it's leaving its DNA behind. I say it's the snake shedding its skin, and that's what your C6 peptide is. It's picking up on that shedding piece. But if you combine these together, it does make for pretty good testing. But you always want to take in the patient's symptoms as well. We don't want to isolate and just look at the test in a vacuum. I won't get off a quick tangent here, but I had a patient this morning, ironic enough, still really high levels of IgG bands, but he comes in and he says, I feel great. All my symptoms are gone. My joint pain's gone. My brain fog's gone. All my digestive symptoms are better. I feel great. He's going off to he's going away for a while. So this was his goal, to get healthy for this trip. And I said to him, your numbers are relatively the same, right? He goes, wow. He was kind of shocked. And we get so fixated on killing the bacteria, right? In a lot of these chronic cases, this is kind of where we get into the immune picture, right? The autoimmune picture. It's not always so fixated on the bug. It's the health of the host, okay? If we make a really healthy, resilient you, a lot of the times modulating, calming that immune system is 90% of the battle, right? So that's a unique case, but I like to at least mention it because it's applicable. So testing, you can do spinal tap testing, right? Takes CSF, cerebral spinal fluid. It has a decreased ability to find antibodies. The spinal fluid of Lyme patients doesn't always correlate with kind of CNS diagnosis. It can evade the immune system. It has long replication time, causing changes in outer surface proteins and kind of like cloaking itself. So again, these are really tricky bacteria. Just know that, again, it's hard to kind of detect on a spinal tap, and then these things can evade the immune system. Lyme bingo. So we talked about those bands on that western blot. This is from Dr. Horowitz, who's a world-renowned Lyme specialist out of New York. But he created, and I'm not sure if it's 100% he created this. I can't comment on that specifically, but I know it's very well known from his bingo bands. So these are bands, band 23, 31, 34, 39, 83 to 93. These are very specific for Lyme disease. So if you see that on your western blot, any Lyme literate doctor should be going through your bands with you on your western blot. And if these are elevated and positive, these are a very strong indicator of a Lyme infection, okay? So again, that classical presentation, well, you're CDC negative, you don't have Lyme disease, but you have, 2 or 3 or even technically one of these bands, you want to raise an eyebrow. This is another really good assessment. It's your Lyme MSID score, so it's basically a questionnaire in regards to symptoms, and it gets tallied up on the quantity of the number. I'll read it here. I thought it was going to come in a little bit better, but basically it says if you score 46 or more, it's highly probable that you have a bacterial infection. If you score between a 21 and 45, it's more likely in that you need to see a provider. 21 or less, the likelihood of an infection is lower. So this is a questionnaire that you can just Google this, right? Lyme MSID score, and you can even fill it out on your own and see kind of where you fall. So I think that's a really helpful tool, and we see a very strong correlation in regards to infections with this. So prevention and resolution, we want to make sure we wear protective clothing. I've got a link to a really good company that does permethrin in the clothing, so you don't have to spray it on you. That's very helpful as a tick repellent. You can do Avon SSS. This is a chemical spray that you would kind of spray on like your lawn or your outside perimeter of your house, your property to kind of ward ticks off. You can. Oh, I did it again. We're getting close, guys. I really appreciate your patience, but it's right there. It didn't go away on me. Yes. All right. That one was easier. Okay. Pericardin on the skin is another one. Garlic, eucalyptus. It's coming up, I promise. Eucalyptus, thyme. Everyone loves guinea hens, right? We can have a guinea hen on our property. I got to tell this story. So my house backs an Amish farm, and one day I'm taking the trash out, and I round the corner, put my cans down, I round the corner to go up my deck, and I swear I jumped 10 feet. There were 3 guinea hens sitting right there from me to Karen and Pastor Keith, and they're funny looking things. Man, it hasn't come up yet. There we go. Guinea hens, right? Guinea hens. So they love eating ticks. And at first I was taken aback, but after I was like, yes, I got guinea hens. This is great. I didn't have to buy them, right? So I was really, really happy. My Amish neighbors, they somehow must have crossed over. So I still haven't thanked them. I got to do that. So the three I's of infection: inflammation, immune dysfunction, and infection, right? Those are the 3 I's. I'm not sure 100% where I was going there when I originally created that, but so prevention and resolution, okay? So this is that link that I talked about. Insectishield, they do a really good job with permethrin-laid clothing. Again, I wouldn't recommend spraying it directly on you, but they put it in the clothing, and that is a natural, that is not natural, but it's a tick repellent, okay? So that works really good. You can do shirts, you can do pants, you can do caps. Obviously wear long protective clothing, right, if you're going out. Make sure you wear a hat. Some people they want to wear the full-on kind of netting. There's nothing wrong with that. I'm not here to judge. But make sure you wear some protective clothing. Long sleeves, definitely long sleeves. definitely a hat. I know it stinks because a lot of the times where rates are the highest are during hotter seasons, right? Warmer seasons. That's better English. Where no one wants to wear long clothes when it's 90 degrees out. But I'd much rather sweat and not have a tick than be airy and have a tick crawling on me. The other one, this is really, really good. I would strongly recommend writing this down, is Tick Shield. You can type in, there we go, we literally talked about it the other day. Cedar Side. Cedar Side is great. This is a natural spray. It's cedar. So you can, I wouldn't recommend, but you could open up in little refresher for the mouth, right? But you can spray this on your skin directly. Works great in tick repellents. Okay, so these are awesome. These are really, really good avenues to use as in prevention. Biofilm killing and more. So these are some natural herbs: oregano oil, cinnamon bark, stevia, biocidin. That's that biofilm that I talked about. There's a study that I'm going to talk about here briefly, but oregano oil, cinnamon bark, clove bud, citronella, wintergreen, Japanese knotweed, and I don't know how I did not put it on it here, cryptolepis, have been shown as effective in treating persistent Lyme disease compared to doxycycline and daptomycin. And this is out of a Johns Hopkins research, which I've put on here. I'm going to show you. But those are the big ones there that have been shown to be very effective in killing basically dormant and non-dormant Lyme disease. So really, really helpful. Here's that study I mentioned, right? So essential oils from garlic and other herbs and spices kill persistent Lyme disease bacteria. And I always mention this to my patients, like, that little school down the road, Johns Hopkins, right? But this is a pretty big deal, right? So you can just see Zhang is the author, but basically doxycycline, cephalosporin, daptomycin reliably killed Lyme-persistent bacteria in lab dish test. In a study in 2017, they found that essential oils from oregano, cinnamon bark, clove bud, citronella, wintergreen killed stationary phase Lyme bacteria even more potently than daptomycin, right? So that's pretty powerful, right? Pretty powerful statement. Also, here's another one. Again, this is from Johns Hopkins as well. I kind of underlined it, right? Among the 7 natural product extracts, at 1% were found to have strong activity against stationary phase Borrelia burgdorferi culture compared to controlled antibiotics, doxycycline, and cefuroximine. So that means that stationary phase means that like persistent, dormant, right? So even getting into biofilms, killing that. Again, we confirmed the 1%. So cryptolepis, blah, 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 blah. I'm not going to read that part, but it's cryptolepis. So we use something called crypto. It works fantastic. The next one is your black walnut, okay? And then the last one is your Japanese knotweed. So cryptolepis, black walnut, Japanese knotweed, okay? Could eradicate almost all live cells with only dead and eradicated cells left as shown in figure blah, 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 blah. So again, it can kill that bacteria. Okay, so I wanted to briefly talk about, because I get questions quite a bit, what if I'm pregnant, or what if I want to get pregnant, right? We already mentioned we can transmit this transplacental, so you can transmit this to your beautiful unborn baby. So you want to get tested, okay? You can, again, we talked about briefly, right? CDC says you can't transmit it through milk, but I just wanted to placed that study that raised a little bit of eyebrows, right? So we talked about those two pieces because those are really common questions. Now, okay, Dr. Ross, what can I do in regards to treatment? I'm concerned about potentially harming that fetus. I'm potentially worried about transmitting the treatment, whatever I'm doing, to my baby through breast milk. So here is drugs in context, right? Table 1, medications included on the WHO, World Health Organization, essential medication list for treatment of less common bacterial, fungal, and viral infections in the pregnant patient. So these are considered to be safe with pregnant women, okay? Typically, I will tell you, in conventional medicine, amoxicillin is going to be used, okay? That's typical. Doxycycline is again, still questionable, but technically they do have it up here, but it's amoxicillin. How we approach this, I don't want to go to antibiotics right away. I want to use, again, that's the whole reason why I talked about those herbs. That's kind of where I want to start with. And then this is my analogy, is antibiotics, like a giant sledgehammer, we got to kill a fly on the wall. We'll kill that fly pretty quickly, but we got to spackle that wall, repaint it. We got some after work to do with antibiotics. Also, again, this kind of a little bit of attention for pregnancy. These are some of the herbs that are considered to not be safe in pregnancy, and that top small portions have been found to be safe. So put an asterisk to this, because a lot of the herbs are just not going to have enough evidence and be studied. So a lot of times they'll say unstudied or not known with pregnancy. I can tell you, herbs they are effective and they are safe. There's a company that we use called Beyond Balance, and they're a glycerin based, because a lot of these herbs are put into a ethanol or alcohol based, right? And a lot of times I don't want to give that to a pregnant mother or breastfeeding mother, even though it's very, very minute. So Beyond Balance is a glycerin based medium. But again, I just kind of wanted to mention this for pregnancy or for breastfeeding. But again, some of the herbs, they're just not studied, so they're going to automatically say, no, you shouldn't use them, right? So again, just putting a little seed in the back of the head here. So treatment pitfalls, again, I mentioned this or touched upon this already. A single dose of 200 milligrams of doxycycline following a tick bite is not effective prophylaxis. Okay, so just getting doxycycline and just saying, oh, I took some, I'm good to go, that you're going to have a world of headache. The degree of tick engorgement should not discourage treatment, right? Just because that tick wasn't engorged doesn't mean I didn't have the infection, right? We talked about that. Infection rates in local tick populations should not discourage treatment. So basically meaning if you're in an area where, tick's not very common, right? You shouldn't be, but we are in an endemic area, just so you know, we are in a heavy populated area. I think I remember one of my doctors mentioning that I think for 4 years in a row, we had the highest rate of tick infection. But don't quote me on that, but it was something along those lines. Treatment with antibiotics for 20 days or less is not recommended with those with erythema migrans rash, as failure rates are unacceptable. So again, you shouldn't, I have an erythema rash, here's 2 weeks of doxycycline. Bad news, that's not going to be effective enough. Insufficient treatment may result in development of chronic Lyme disease with significant long-term morbidities. So ILADS is your International Lyme and Associated Disease Society. This is a very well-respected society, right? They're the cutting edge here. So for prophylactic, and again, this is not for antibiotics. I personally do not prescribe antibiotics, and my recommendation is herbals first, but standard treatment according to ILADS is prophylaxis after a tick bite, even for asymptomatic, giving a minimum of 100 to 200 milligrams twice a day, for 20 days, for a single stat dose, is, again, ineffective therapy. For acute treatment, as soon as an acute Lyme is identified, 4 to 6 weeks minimum of at least that 100 milligram twice a day. Always use clinical judgment for each therapy. And again, I'll quickly just hit upon this. Why is it so hard to kill? Oh, I thought I did it again. Why is it so hard to kill? Right, it's just rampant, number one, right? 10 to 20% of cases are this persistent Lyme infection. And this is the term, post-treatment Lyme disease syndrome. So that is in the medical field considered chronic Lyme. Again, so it's technically called post-treatment Lyme disease syndrome, chronic Lyme disease. Okay, indicates persistent cells or persister cells, which we've already talked about, and you can kind of see this here. I should have deleted that photo. I knew I should have, but you can tell here. So you can see this is your biofilm. The green. We're almost done. We're almost done. I know I said under an hour. If anyone's my patient, they'll not be surprised I'm going over. I'm going to head north. Okay, so quorum sensing. Well, I'm getting it. So this is your biofilm in the green. And you can see the blue here is Borrelia, right? So these antibiotics, they can try and get in, but they're sometimes a lot specific antibiotics are not going to penetrate that biofilm. We need to make sure we disrupt this biofilm matrix so that we can expose that Borrelia. I love that picture because that really kind of gives it a good sense of what's going on. And then if we want to try and detect for that, we have immune evasion because of that biofilm. So now when we're testing for it, we're missing it because it's buried in that biofilm. So that's a really good picture. This kind of is, I'm sorry, it's a bad picture, but it's talked about kind of like the persister cells. That first top picture, basically it's the cells that are burying itself in the tissue. We're trying to kill it, so we end up killing it, but we still have that middle picture, we still have those persister cells, and they essentially end up re-replicating, and we're back to square one again. Quorum sensing, really cool, but also really kind of scary. So what these cells can do, they can attach themselves, this bacteria can attach itself to another cell, and they can basically communicate from cell to cell, and the cell can basically, can almost shield itself and mimic itself as that cell it's attached to. So again, another way to evade appropriate testing, right? I thought I'd mention that because it's really very interesting. Again, we talked about this briefly, but again, this can be considered an autoimmune condition or activate autoimmune condition. So here's a very reputable organization, right? Autoimmune Association. I'm sorry, you can't see it as well here, but while not classified as an autoimmune disease, research indicates that Lyme disease may trigger an autoimmune response or its symptoms may mimic an autoimmune disease, right? So, Dr. Ross, we treated it, right? My patient this morning, we treated it. We've knocked down the bacterial load, but I'm still positive. But I feel completely better, right? Because we've knocked down the load enough to calm the immune system, and we've also taken care of that patient as a whole, so that their immune system can handle that chronic infection, right? So it's good to put in the back of your mind, this can trigger or act like an autoimmune condition. That's why we get these cyclical symptoms. I feel great for a year. I had a major stress response. I got into a car accident. True story, patient got into a car accident. They had a lot of back pain. We thought it was from the car accident. Went to the PCP. PCP said, I don't know, let's send you to orthopedic. Orthopedic said, I don't know, send you to pain management. Pain management said, I don't know. Came back to me, let's retest you for your Lyme. Whew, through the roof, right? So again, you can be re-triggered and re-flared without a reinfection. That's where the autoimmune piece comes in. What to do, this is a great slide, take a picture of this. What to do if I get a tick? First, remove that tick as fast as possible. Do not kill the tick, try to keep the tick. Bag that tick, okay? Send it to a lab. For us in Pennsylvania, we have free tick testing at www.ticklab.org, okay? Or you can obviously come to moi, come to Turnpike Health. Get tested. But remember, we talked about that. If you get tested right away, we might miss that IgM antibody. So typically wait that 2 to 3 week time frame, but call a Lyme literate doctor. While you're waiting, get started on your cryptolepis, get started on your Japanese knotweed, get started on your black walnut, right? Start some of these natural botanicals right away, okay? That's huge. Does anyone need that again? Okay. And then lastly, just real quick, I'm only about 5 minutes over, yes. Differential diagnosis, right? We get so fixated, again, Lyme disease, it's Lyme disease, it's Lyme disease, it's a bug. We need to make sure we're assessing other potential issues, and we need to make sure we have a healthy person, right? We have a healthy host, the host. It's the human being, not the bacteria all the time. So, assessing for EBV, hepatitis, HHV6, endocrine disorders, make sure that we talked about that iron deficiency, right, and other nutritional deficiencies. Make sure that we're not dealing with a rheumatoid arthritis flare. That's a whole other thing. Sometimes, again, as we mentioned earlier, that infection can trigger, literally right before I left, I had a patient who had a previous exposure of Bartonella and had rheumatoid arthritis markers triggered. Hey, I don't have any arthritis in my family. Nothing like that. Most likely that infection triggered those autoimmune markers for rheumatoid arthritis, right? So literally just before I left, that's a conversation I had with a patient. Environmental considerations, and again, immune. Really important, we want to focus on the immune system. This is really just continued, again, just looking at other things, right? POTS, mitochondrial dysfunction, pain syndromes, liver dysfunction, making sure we're assessing the patient and having a healthy patient as well, because we get so fixated on that bug. I believe that's it, and I love this photo. This is one of my favorite photos. I probably have to get it printed and put on my wall. But you treat a disease, you win, you lose. You treat a person, I guarantee you'll win no matter the outcome, right? So we kind of just forget the person in traditional medicine, and the person's the most important thing. All right, everyone. I was 7 minutes over. Not bad. And I will say this because I say